The incorporation of molecular testing in patients with ovarian cancer has been transformational over the last several years. Germline testing of BRCA1 or 2 alterations should be incorporated as a part of standard care for these patients. There are significant implications for family members of the affected patient, specifically as they relate to risk-reducing surgery and counseling, but there are also very important implications for the patients themselves when it comes to therapeutic options, most specifically as it relates to the data and the approval of olaparib following SOLO-1 in patients who had a BRCA1 or 2 alteration, and the really dramatic improvement in progression-free survival with incorporation of maintenance PARP inhibitor in the frontline setting for these patients. So we believe that germline testing has a defined role, although we can continue to do better in clinical practice. In the same breath, somatic testing is important because, again, it has potential implications with respect to therapeutic management of the patients in the front line and will inform how we can counsel patients about how they may respond to treatment. More recently, homologous recombination, which is a term that we use to describe a set of potential molecular aberrations or changes that could reflect in a certain way with respect to the genome, have emerged as also a possible predictor of response to PARP inhibition. And there is promising data suggesting that patients who have epithelial ovarian cancer and homologous recombination deficiency may benefit from the addition of PARP inhibitors in the maintenance setting in the front line. It's a little bit more difficult to determine whether or not homologous recombination deficiency will emerge as a sufficient biomarker predictive of response in these patients, but this is an active area of investigation. Building on these BRCA germline, BRCA somatic, expanding to homologous recombination deficiency, we are also entering an era where we have disease site agnostic drug approvals. Pembrolizumab was approved in patients who have mismatch repair deficient or MSI high recurrent disease. So there may be an opportunity in patients with ovarian cancer to also test for mismatch repair deficiency or MSI status to determine whether or not these patients would be eligible for pembrolizumab therapy. And most recently, in April this month of 2020, the FDA granted a breakthrough therapy designation for pembrolizumab in TMB high tumors based on data from Keynote 158. So we are determining that there may be multiple molecular targets that we need to test for in patients with these malignancies, and we anticipate that this data will change over time.